This is Robert Whitfield. I'm a board-certified plastic surgeon in Austin, Texas, where we achieve natural results through art, science, and innovation. Today, I'm going to talk about the Zoom lift. It can take less than an hour in our office. You can resume normal activities the next day and limited exercise right away. So we've all been on Zoom meetings, Microsoft Teams calls, Skype, GoToMeeting, and since as early as February 2020, how we interact has changed forever. We now started to see ourselves on camera each and every day. We noticed our necks, cheeks, and puffy eyes more than ever. This has led to more and more demand for ways to rejuvenate these areas with little to no downtime. One of the main culprits in all of this is the platysma muscle. The platysma muscle comes from the origins of the pectoralis and clavicular area and then inserts on the bottom of the jaw. It's our grimace muscle. As we age, those bands are separated and they start to fall down and become more visible. Traditionally, we use sutures, and this allowed the bands to be aligned in the middle of the neck and really give a nice appearance. Now, this had been done through surgery really traditionally. And then over the past decade, more and more work has been done to do this in a percutaneous way through really small openings. Here, Dr. Miller has presented his paper, The Percutaneous Trampoline Platysmoplasty Technique, an experience with 105 patients. And that's where that photo came from. Dr. Miller has done extensive work on this. And so now when we use this Zoom lift using My Ellevate compared to an open lift, here's what we need to review. The Zoom lift is office-based. There's no need for any IV medications. There's no general anesthesia. It's all done under local anesthesia. You wear soft dressing in the form of a little cervical collar for 10 days. You return to normal activities the next day and light exercise that week. Now, for an open lift that we typically would do with a facelift, it requires at least a surgery center. It does, of course, require an IV. It requires anesthesia. It's done most commonly with a facelift, like I had mentioned earlier. You have face dressings, drains, sutures that require removal in the office. The downtime is a minimum of 10 to 14 days. And obviously, there's more visits in terms of evaluating the results, removing sutures, and things of that nature. Now, when we do the Zoom lift, like I said, it's through a series of small openings. These are all 2mm openings. And markings for the treatment allow us to do this more precisely. Here, we're marking the jawline and small points along the jawline for these small openings. And then using the suture with a light rod, we can go beneath the jawline, around the neck tissue, secure it at either end of the ear lobule on either side, and then tie it off in the middle to get really beautiful results. So here's a gal. She's 1 week after a Zoom lift with My Ellevate. So the neck bands are appreciably taken care of. She has not a ski slope neck anymore, but a very nice slope to her neck now. It's rejuvenated. She has a tiny bit of light bruising at a week, but nothing substantial. And she's going about her business, doing her activities of daily living. She's performing light exercise, and she's on her way. This can be done in combination with a variety of other treatments, including energy-based therapy like Face Tight, Morpheus 8, Fractura, as well as liposuction of the neck. And you could also use this in combination with facelifting techniques under local anesthesia if you chose. So to learn more about the Zoom lift and other options for face and neck, text Dr. Rob to 72000, call us at 512-645-1492. You can start a chat with us on our website at www.drrobertwhitfield.com. We look forward to hearing from you.